But where do you stand on this topic? You're a pediatrician. From your perspective, what would you say are the most important facts that people need to understand about vaccine safety?
I think the first part is to start with, there shouldn't be questions that we can't ask. I'm not against vaccines at all. I mean, I did all the regular training in my office. People vaccinate. I just feel like we want to get to the truth. We want to know everything we can know. We want to make things better. We want the safest products possible. There's no way today we have the safest products that will ever be in humanity. And so there's no reason why we shouldn't be able to discuss this. But unfortunately, vaccines have been one of the most controversial topics to the point where the word was basically censored off the internet, certainly on social media. And other than if you said safe and effective, you couldn't really say anything else. You can't ask any questions. And I think that's really frustrating as a pediatrician. It's really frustrating a lot of parents. And we're at this point where people just don't trust anything because they feel like they're being censored and they're not really sure what to believe. And really all the information out there is very one-sided. It's either vaccines are the best thing ever or they're the worst thing ever. And that's really confusing for the vast majority of parents who I'm sure are somewhere in the middle. And that's pretty representative of the patients that I see. I don't feel like people should be forced to do anything. I feel like they should be given good information. And that's the way we do things in our office. But I'm not against them. I just feel like there's a lot more that we need to learn.
There's a lot more indeed that we need to learn. And I feel like often what you hear parroted on social media isn't necessarily fact-based, but more dogma and groupthink.
For sure. I think it really boiled over during the pandemic with the use of the phrase safe and effective. To me, that's where the establishments really lost people, because it would have been reasonable to say, based on the information that we have today, we feel like the benefits outweigh the risks that we know right now. That's a reasonable thing to say. And we can say we don't know what it's going to be like in 10 years. We don't know if you're going to grow a third arm, but we think it decreases mortality. We think it keeps you out of the hospital. And so we recommend this. That's a reasonable thing to say. But when you hear safe and effective, that doesn't even make any sense. You can't say something is safe without knowing the long-term implications. And nothing is 100% safe or 100% effective. And just discussing that or asking questions doesn't make you anti-vaccine. It just means you have questions, you want it to be as safe as possible, you want to understand the risks versus the benefits, and that's how we do everything in medicine.
Amen. Do you, I want to get into the details, but are you expecting pushback on the publication of your book?
I would imagine there will be pushback. I think anything that discusses vaccines and this topic will always have pushback. And it doesn't really matter what you say. The topic is so controversial that if you say anything besides safe and effective, then you're going to be hailed as an anti-vaxxer or promoting vaccine hesitancy. And if you're not saying that vaccines are the worst thing ever, then people that are very staunchly anti-vax will say, you're telling people to get vaccines. Vaccines kill people. I mean, it doesn't matter what you say. You're going to get pushback on both sides. But I feel like we just need to discuss this. I don't have a motive for this book. I don't have an interest in telling people to get vaccinated or not get vaccinated. For me, the goal of the book is really to open up debate and discussion and to really look at the research that is out there, synthesize it, show both sides, try to find some bridges between individuals that are so pro and so anti, and understand the other's perspectives. That way we can move forward, ask questions, and really figure out what the research is that we need to do next, and figure out why people are hesitant. What are the questions that people have? And let's get that research.
Amen. And I've rarely, if ever, met anybody who is universally pro or anti. It's just that people get put in those camps.
Right, exactly.
Which is deeply unfair. It shuts down conversation.
There isn't conversation. And that's the first thing that we need. I mean, if you look at most vaccines, there are two different universes out there when you're talking about the same product. Like the COVID vaccine, for example, you would go on one website and it would say it saved millions of people and saved trillions of dollars and it's the best thing ever. And then you go on a different website and it says it's killing way more people than it's helping and it's the worst thing ever and we need to pull it off the market. And both things can't be simultaneously true, or at least it's a nuanced conversation. And the individuals that are saying these things need to talk to each other. We need to have discussions and debates so that way they can express their concerns, express why a scientist feels the science is a certain way, and then discuss and debate that at Harvard and Johns Hopkins and on podcasts and wherever. Like, we need to have these things openly and discuss them so we can move forward. And I think if people actually discussed these things for an hour or 2 hours at a time, we'd have better information. People would understand the other side. They would say, oh, well, that kind of makes sense what you're saying. We don't actually have research on that. Well, let's do a study on that. Let's figure that out. Or someone might say a bunch of stuff, and then the other person's going to say, no, we actually do have this research. Here's where it is. And that might make you change your mind. And I don't have one opinion on all vaccines that's never going to change. I want to be given information. I'm totally happy to change my opinion. The end result should be about healthy kids. That should be our only goal. And it shouldn't matter whether that's with vaccines or without vaccines or with medications or without. We need to figure out what is the best for our kids in the long run. And we shouldn't put anything just on a pedestal just because. It should be proven to really help them. We want healthy kids 10 years from now. And if there are things that we can change, maybe there's an ingredient in vaccines that is causing an issue, or maybe the schedule and the way that we're doing it could be changed or improved to make things better or decrease risk. Like, why wouldn't we want to do that? And if it's the very best that it's ever going to be, and we keep getting research that shows that, great, then that's the information that parents are going to want to read to give them comfort that they're doing the best thing for their kids. But I don't feel like parents feel like they're being heard, and they don't feel like their safety concerns are being listened to, and it feels like it's about money and not about health, and that needs to change.
Facts. Now, you've said that you are a pediatrician, and you've said that your practice administers vaccines. Have you seen vaccine injuries?
I have seen minor injuries. So there's two different things. I haven't seen major injuries from patients that I've been taking care of. So I do think that the serious things that we read about are rare. I've definitely taken care of people who swear that it happened and came to me after. I've not seen it. I've seen fevers and rashes and not feeling good and crying, like the things that you hear more commonly. I've never seen, from what I can tell, a child who was completely normal in one day and the parents feel like they're autistic the next day. I've never actually seen that, and most doctors haven't. But there are many parents, an increasing amount, that say that occurs or that something happened, and I think that's important to listen to. We should be listening to parents and listening to moms and dads who feel like their child got a product and then had a serious reaction. These are not people that are anti-vaccine or that are crazy, crackpot anti-vaxxer tinfoil hat wearing people. These are people that went to the doctor, believed in vaccines, got a vaccine, and feel like something happened. Now, it doesn't mean that that's true. You can have a vaccine this morning, have a heart attack this afternoon, and die, and it could have nothing to do with the vaccine. But if a whole bunch of people are saying the same thing, that's a good piece of information that we should take to say, hey, maybe people that are getting this thing are dying this afternoon. Well, maybe we should look into that in a study and see if the thing is actually causing that. That's not crazy. That's just research and science. That's how we inform things. And it may not actually be true, but we should be listening to parents with increasing frequency who are saying the exact same thing and not dismissing that.
Well, the COVID vaccine was a perfect microcosm of this, where at the very beginning, any conversation around cardiomyopathy risk in men was shut down, whereas the data, of course, has come out in the years since then showing that it actually does present a real risk.
Right. This is how things happen. We had a rotavirus vaccine that came out, and it was causing intussusception or bowel blockage in kids. They pulled it off the market because it was causing that. We had polio vaccines, the oral polio vaccine back in the day, that was causing more polio than there were actually polio cases in the country. So we pulled that one off, and we just used the inactivated polio vaccine. And the same thing with COVID. I mean, these things happen. You can't expect research necessarily to find every single issue, but we have to listen to people after the fact and assume that there could be some potential complications or issues that we didn't realize were going to happen. And we also shouldn't just trust companies, right? These are the companies that are making money off of their products. They obviously have incentive to set up the trials in the best way possible to show the most benefit and the least harm. We shouldn't trust that as gospel, that that's all the problems that could happen with a vaccine. Any medication we take could have issues, and we don't have any sort of system right now to truly capture these issues, especially long-term issues.
Yeah. And also, like, I'm not a parent, but I would imagine as a parent, especially as a first-time parent, I mean, you're bringing into the world your most perfect creation to date. And to be putting that creation in the hands of, these companies that have these multinational corporations that have in the past not placed consumer health at the forefront, and have cut corners and have betrayed consumers and patients in many ways. I mean, I think about the field that I know particularly well, which is the Alzheimer's space, where, drugs have been, greenlit despite panels of experts pushing back, stating that there's like no real benefit. They impart side effects, dangerous ones at that. So, I mean, I think about that, and then I think about, offering up to these same companies, these same regulatory agencies, your most perfect creation to date. Like, that's why I think the title of your book is so brilliant, Between a Shot and a Hard Place, because it does leave parents between a rock and a hard place, oftentimes deciding what to do.
It is a very tough decision, especially now, because when we were growing up, there were only a few vaccines, and there are so many to do that any logical, caring parent is going to have concerns about doing 30 or 40 of anything to their child. That's a reasonable thing to think. It doesn't mean that it's wrong. It doesn't mean that there aren't benefits. Of course, there are benefits to vaccines, but there are many unanswered questions, and those questions are growing as the schedule keeps growing. We have new vaccines coming in the market almost every single year, it seems like. Just in the last couple of years, we had the COVID vaccine come on. We had an RSV, respiratory syncytial virus vaccine, come on. We have, in the last decade or 2 decades, the flu vaccine now recommended every single year. I mean, there's just more and more vaccines.
They're just piling them on.
And there's some good with that. I mean, you want to protect from diseases, but at the same time, where is the research looking at what are the cumulative effects of these vaccines on our health? Where is the research that shows that this is the best schedule versus something else? We're just adding more and more without kind of going back and getting that fundamental research that we really need to look at overall safety. And I think that's what concerns parents, because yes, they say, oh, well, a vaccine has a small risk of X, Y, and Z. But what about when you have 30 and there's a small risk? And especially today, where doctors and parents are in very different worlds. Doctors might see the super rare thing. An older doctor might have seen Haemophilus influenza. They might have seen somebody get really sick with measles. They might have seen somebody have diphtheria. These are things that doctors see. They go to the ICU. They see a patient die. It affects them, and they're worried about those things. Most parents have never seen any of these things. Recently, this last year, we're talking about measles a little bit more, but even that, there's still only a few hundred cases at this point, versus what parents see, which is autism and asthma and allergies, and every other kid seems to have that these days. And so it's a very different frame of reference or perspective. And it's not unreasonable for a parent to say, hey, when I was growing up, nobody had a peanut allergy. When I was growing up, I don't remember anybody with autism. And yet, everywhere I look in my kid's class, this is going on. Should I be worried about that? What are we doing? What's going on to cause that? And vaccines, everybody hears stories about it online, and so it's not unreasonable for a parent to wonder, maybe this is related. And if we're not listening to that concern, then we're running into this issue where hesitancy is going through the roof. I mean, we are literally seeing the issue that doctors are trying to prevent. We had 70% trusted medicine before the pandemic. Now it's 40%. Exemption rates are the highest they've ever been. Kids that are unvaccinated are the highest they've ever been. The very thing medicine's trying to prevent, they're actually creating by not talking about this. And we need to think about that. We have to look in the mirror and say, hey, we're not addressing concerns that parents have.
Well, why do children require a hepatitis B vaccine? That's something that I have in the past scratched my head about many times. And I think, were they not mandated like in the 90s, 80s and 90s? Like, I feel like I've been vaccinated for hepatitis B. But as far as my memory serves, I was not having sex as a toddler, nor was I using drugs. So what is the concern there?
So, well, the concern with hepatitis B is it can be very serious. It can be fatal. It's one of the leading infections in the world. So it is actually quite severe, and it is reasonable to have a vaccine for it. Really, the big question, I think, is around if we have to give it to a newborn baby on the first day or two of life. And that, of all the vaccines and all the controversies, seems to be the biggest. I mean, that's the one, to me, that so many parents, it just doesn't make a lot of sense to them, because now we have testing for that. Originally, it was just for those at high risk. So when it first came out, it was for sex workers and individuals who were exposed to hepatitis B. And then at that, about a decade after it was out, or a few years after it was out, there was concern that there were still rising cases of hepatitis B, and so they decided to put it on the children's schedule, and they decided to put it for a newborn baby to make sure that everyone was prevented from it. And from a positive aspect, hepatitis B rates have gone way down. So it is working. The question is, does a newborn baby need it? Can we give it to them later? What is the effect of giving a newborn baby on the first day of life a vaccine, and how does that affect them in the long term? And a lot of parents have that question, and a lot of people do decline it and do it later, but there's still this recommendation to do it for a newborn baby. And for a lot of parents, that's something that really triggers a concern around vaccines, because it doesn't make a lot of common sense to give a newborn baby in the first day of life a vaccine if there's no one in their family that has it. I mean, if the mom has it, that makes a lot of sense, right? You don't want the baby to get it. If someone in your family has it and they can be exposed to it, that makes some sense. But if nobody around you has hepatitis B, your risk is exceedingly rare. So parents reasonably might ask, well, can I just give it to my child later? And this already starts off this combative, almost dichotomous situation between the doctor and the patient, because they don't want to do something they're being told they have to do it or they should do it, and it doesn't make a lot of sense to them, as opposed to maybe we can reevaluate it and say, well, look, if you're high risk, then we recommend it, you should do it. If you're not high risk, then here are some other options of you could do it later. That makes a lot more sense to me, and I think if people started seeing those kinds of things happening with the CDC, they'd have a little bit more faith in the establishment, but I just don't see it happening. Right now it's do more. That's all they see, and I think that's a big concern for parents.
Well, how would you steelman the arguments that advocates for it make? Like, is it just to protect babies who are at high risk due to maybe their parents' behaviors and inclinations, or is it also, maybe a kid gets injured on the playground and needs a blood transfusion? Is that part of the concern?
From what I've read through the different books, the big concern, number one, would be mom has it, pass it to the baby, and maybe the test was wrong or they never tested the mom, so there's some sort of missed hepatitis B that it gets passed to the baby. You don't always know if you have hepatitis B, so somebody around you could have it, and maybe they bleed on the baby. Like you said, you could be on the playground and somebody else has hepatitis B and you step on a needle, but that is exceedingly rare. So I don't think it's unreasonable to say, well, here is your risk. Here's how your baby could get it. It is possible they could get hepatitis B, but it's a 1 in a million chance or 1 in 100,000 chance. If you want to get hepatitis B for your newborn, then go for it. Here it's available. But if you don't, then you can do it at this time or this time, and that's still reasonable. And from anything I've ever read, it still seems like it's more of a public health initiative than an individual initiative. And I think it's more to make sure that everybody's vaccinated, so that way it decreases the risk of hepatitis B for everyone, and it decreases your risk later because maybe the baby doesn't get it, and then now the kid's a teenager, and they maybe the family would want it, but they just don't go back and get it. And so now they're exposed to hepatitis B when they're 16 years old, when they could have been prevented if they got it as a newborn. So I think it's more of a, let's just give it to you when you're young to prevent it later. But when you're adding more and more vaccines, that is something that we can think about, that maybe this is one of those that we could recommend later. And it's not like everybody in the world does it that way. Most other countries don't. So there isn't just one way to do vaccines. I mean, most countries do a lot of similar vaccines, and they're fairly similar, but it's not the same everywhere.
Well, how do you propose we balance individual risk with public health goals?
Well, I think that comes down to having discussions around this. I think that's the first thing, having open debate and discourse, and then going back to making more recommendations than requirements. I think that's a first step. And the second step would be to look at risks versus benefits. I think that with an ever-increasing amount of vaccines, first thing we have to do is acknowledge that there could be some long-term risks, then start to research those long-term risks, and then balance what is the benefit of this for certain vaccine, how many people are actually getting it, how often is it happening in the population, and then is this something that is really needed, or can it be done later? And you can still offer these things, but they don't have to be on the required schedule, the recommended schedule at that age. They can be done later. So I think we can ask those questions and balance those two things. And if diseases start to come back a little bit, then we can always reevaluate that. It doesn't have to be something that we're going to do forever. Like, nobody has had polio in a long time. So it wouldn't necessarily be unreasonable to say, okay, maybe we remove the polio vaccine from young babies and we offer it to you later, unless you're traveling to somewhere with polio. But obviously, if polio starts to come back, then that would need to be reevaluated. Maybe you would want to start doing it at 2 months old. But if you're prioritizing certain vaccines and you're like, well, we don't want to give 20 vaccines in the first year. We'd only want to give the top 3 that we really think are important, and we'll push some of the other ones back. There are ways to do that, looking at how many people have it, what's the risk factor, and we can do that, but nobody wants to ask those questions because then you're inherently saying there could be an issue.
How many doses are currently required for people under 18?
So, I mean, required, you don't have to do any vaccines anywhere. You have to do them for school in a lot of places, and that's different everywhere across the country. But the CDC schedule, it depends on how many combination shots you're getting, but it's in the 30s to 40s at that range if you're doing combination shots.
And if you stack on the vaccines for the flu, for COVID,
it
then
goes higher.
it quickly escalates to some in the 70s.
Yeah. So the number 72 is antigens. So if you're doing, let's say, the diphtheria, tetanus, pertussis vaccine, that's counted as 3. So if you were doing it by antigens, it's like over 100 now because you add in a whole bunch more COVID shots, the RSV vaccine. But in reality, you're getting maybe 30 or 40 pokes, maybe less even if you're doing more of the combo shots.
And has that increased over time?
It's increased rapidly. So especially after 1986, we have a lot more. So originally, you had the smallpox vaccine and the vitamin K vaccine, and then smallpox, we wouldn't really have any more smallpox, so we took that away. And diphtheria, tetanus, pertussis came on the market, then polio, and then measles, mumps, rubella. After that, around in the early 1980s, there started to be increase in lawsuits, especially around the DTP vaccine, the original one, the diphtheria, tetanus, pertussis. There were concerns around inflammation of the brain, encephalitis, and because of all these lawsuits, a bunch of vaccine manufacturers decided they were going to pull from the market because they were too concerned about all the impending lawsuits. And because of that, there was a lot of concern that nobody would make vaccines. So they created the 1986 Vaccine Act, which basically gives them essential immunity from any sort of liability, or really there's no ability to sue them, or it's very difficult to do it. And after that point, things exploded. Now, again, some of that's good, right? Because we have more vaccines against diseases, but there's also this push to get things on the market. And so we have a lot more. We had Haemophilus influenza, pneumococcus, rotavirus, flu. I mean, there's a bunch of them. So
and they're shielded from liability, the vaccine makers.
They're shielded from liability. So if something happens to you, you sue the HHS. You don't sue the vaccine company.
Wow. I think I mean, I'm no expert in this regard, but I mean that seems wrong to me, that you can't sue the makers of these vaccines were you to incur a vaccine injury.
It's a very interesting dynamic. I think that when you live in the world in the way that we live, especially in a capitalist society, one of the main drivers for safety is the fact that you can get sued. And the fact that we've taken that away from vaccine manufacturers really stops them from needing to worry about safety. So they have every reason to get something on the market and do the test in a way that shows that it's safe, and they don't have to totally prove that it's safe, and they definitely don't want to study it after. There's no reason for them to continually study something and say, oh, we found this problem. Because they don't get sued if there is that problem. So somebody else has to figure that out. Why would a company study their own product to find something wrong with it? So we've taken that away, and I think that's a big concern and something that needs to be very mindfully and thoughtfully discussed. Because if you do put it back and you do give them liability again, and then a whole bunch of people start suing them, then you can also still lose all vaccines. So I think it's a balance, because you don't want all these companies to go out of business, but you also want them to have some sort of threat that they have to do. Like, they have to do the right thing. They have to make them better. And I think if you did have that threat, like most other products, you see things improve over the years. You see the ingredients get better. You see them researching and looking into how to decrease that risk. There's nothing doing that right now. And you know, maybe there's a way where you cap the liability so you can't get 10 million per lawsuit, but maybe there's a way where you can give them some liability without necessarily putting them out of business. So that way they have to really think twice. And ideally they don't want to get sued. It doesn't stop them from making it, but it makes them focus a little more on safety. It focus a little bit more on creating better products. And again, there's nothing controversial about wanting better products. We shouldn't assume that we have the best vaccines that humans are ever going to have. We need to look at where we are and have better, safer products 10 years from now. And we've done that before, but you're not seeing things getting pulled off the market anymore because they have no reason to do that.
Is what you were describing, is that what's referred to as post-market surveillance?
Correct. So the way that we currently, so originally when they're doing the studies, they're doing things pre-market. So the company in general is studying their products. They're doing clinical trials. They do lots of safety trials, but generally they're rigged a little bit in the fact that they aren't studying them against an inert placebo like salt water. They're studying them against some other vaccine or maybe an earlier version of a vaccine. And then they can say, well, it doesn't show any safety signals compared to the other vaccine, so it's safe, we can put it on the market. That's how most of them have been done.
And they'll compare it to, sometimes, correct me if I'm wrong, they'll compare it to all of the additives that are typically found in the vaccine, but without the antigen. So they're not controlling for these like additives, which many people are concerned about.
Correct. So most of the vaccines that are on the market today were either studied against an earlier version of that vaccine. So, for example, the DTaP, the diphtheria, tetanus, pertussis, would be studied against the older DTP, diphtheria, tetanus, whole cell pertussis vaccine, which was pulled off the market. So you're saying it's safe, but you're saying it's safe against the DTP vaccine, which was then pulled off the market. So that's how they get around that. And a lot of the times with the studies, they're still getting some of their other vaccines at the same time. So you're studying it like that, not against an inert placebo, not against an unvaccinated kid. Or some of the trials are like you mentioned, where the vaccine is given against the vaccine without the antigen. So you're getting, let's say, the rotavirus vaccine without the rotavirus part in there. So you are not studying against saltwater. And when you have a vaccine on the market, the ethical concerns around it are, well, if you have a certain vaccine on the market, then it's unethical not to give kids that vaccine, so we have to study the old one versus the new one. But there are even examples where, like for pneumococcus, the first vaccine that was on the market, there was nothing else. There was no other vaccine that was needed to be given because it didn't exist at that point, and they studied against the meningococcus vaccine. So why wouldn't you study against saltwater? There's only one reason for that, right? I mean, we know why that is, and they know what they're doing, so that's why they do it that way. So you have this safety research that's based on, I guess I would say, like faulty or not full safety evidence. And that's when you hear people like RFK talking about the fact that they haven't been studied in the perfect way or they haven't been safety tested. The wording is very key because it is really important to note they have been safety tested. They've all been through clinical trials. They've all been through placebo-controlled trials, but they haven't been through inert placebo-controlled trials. So they get around it by saying it's been placebo-controlled trial, but the placebo is another vaccine. So it's the wording, but it makes a big difference because what someone like RFK is saying is, look, it was never studied against unvaccinated kids. And that's how you get a baseline of safety. But other people say, no, it was placebo-controlled trial. So it's the wording that matters, but it was never vaccinated versus unvaccinated kids. And so we're in this position now where all of these trials were never studied against unvaccinated kids. We don't really have any studies with unvaccinated kids. And so we have no idea what are the implications on health or chronic disease for unvaccinated versus vaccinated kids. And we're assuming that this is overall beneficial. And I think we could logically say, yes, if you get a vaccine like for measles, it decreases your risk of measles. The question is, at what cost? At what cost to other things?
And how concerned are you about the additives? Like, aluminum, mercury, are those not routinely used as vehicles?
The answer to that question is I don't think we have any idea to know how concerned to be. The standard research, the standard thinking would be that we don't need to be concerned, but our understanding of all of these ingredients evolves so much over time. And the classic example of that is lead. We were not concerned about lead at all for a long time, and it was in everything and in paint and in our pipes. And then now we say, you shouldn't have any lead. That's a bad thing. And then mercury was in vaccines for a long time. It's not really in the vaccines anymore, except for in the multi-dose flu vaccines, but they took it out. It was never proven to be harmful, but mercury has been proven to be harmful, and it's a different form of mercury, but still after the research and when people noticed, hey, you're giving more mercury to kids in these vaccines than is allowable in food, then people are like, oh, that's true. But the fact is no one ever thought about that before, right? No one ever thought about that before. They just put it in there. It was a preservative. And then individuals realized, well, we're actually giving so much of this. could this be a concern? Then they started to look into it. It wasn't definitive, but they pulled it out anyways. Now we use aluminum, and the going theory still is that it doesn't cause an issue. It's such a small amount. We don't need to be worried about it. But in every other sense, we are worried about aluminum. We have limits in water. We have limits in the air that we breathe. So at some level, at some dose, certainly aluminum would be concerning. The question is at the dose that we're giving it, is that concerning? And we say no, but then we keep adding more and more vaccines and you're getting more and more aluminum. And at some point, I would think that would be an issue, and nobody talks about that.
I've heard some on social media say that aluminum is added to basically stimulate an immune response so that less of the antigen would be required. Is that factual?
So that's correct. For most of the killed vaccines, it doesn't work very well because your immune system isn't stimulated enough because you're only giving it one part. So the aluminum's in there as an adjuvant to help stimulate an immune response to give you a better antibody response, a better response in your body, better memory. So there's a reason why it's there, and I don't think that is controversial or that isn't concluded at this point. I think we know that it works, but the question is, again, at what cost? At what cost? And do we need to be worried about this? Do we need to be worried that it has something to do with asthma or allergies or autoimmune conditions or autism? You have to ask those questions, and you have to research and study that, and you have to be open to the possibility before we can ever see any changes. And that doesn't mean that it needs to be. It doesn't mean there's a problem, but it's not unreasonable to ask when you say, oh, we can have only 0.2 milligrams per liter of aluminum in drinking water, but you have 0.25 milligrams of aluminum in a hepatitis B vaccine. The numbers are not very different. I mean, we did this with mercury, and I think it's reasonable to ask about aluminum too.
Yeah, I would agree with that. So how is then a parent who has a full-time job? I mean, raising kids is a full-time job. So how then are parents to know in which direction to go? I mean, are they just to trust their pediatrician? Are they, is it important for them to do their own research? Where is one to even begin?
To even start to answer that question, I have to talk about my general philosophy on vaccines, which to me is my job is to teach. My job is to inform. I don't tell anybody what to do, not in my office, not in the book. I don't prescribe any specific schedule. I don't feel like I should be telling anybody what to do outside of the CDC schedule. I think that's very arrogant to say that I know better than the CDC or all the people that have researched this in the past. And I think it's not unreasonable to do that if you've done your research and you feel like that's the best for your child. But to me, it's really important that we start to ask questions. And I think it's not unreasonable in any way for a parent to have concerns, for a parent to ask questions, for a parent to discuss this with their doctor and to do some research and to look into that themselves. I think that's really important because until we do that, we're not going to move forward. And the more that people look into this, the more concerns and questions that have come up. And I think we need to respect that. I think we need to listen and try to move forward in a way that's more respectful. Not to say that you shouldn't listen to your doctor. Of course, that's a reasonable thing to do. But we also have to push back a little bit and say that we want more research and more data. And we're not just going to accept the status quo. So that way we can have safer, better products for our kids in the future. And so it's not an easy question because I can't tell people what to do or what not to do. And we have to make decisions based on the best information that we have today. And nobody has a crystal ball. But at least for the book, that's what I was trying to do, trying to provide information, trying to show both sides, trying to show the big questions that people have. So at least they can be a little bit more educated on the big questions. And hopefully that helps them to make some decisions at the end of the day. But you have to decide for your own kid.
Well, I think what you hinted at is so important, that this should be ultimately a conversation that you have between, you and your physician, your pediatrician. But what are some questions then that people listening might ask their physicians to gauge whether or not they're even open-minded to having this conversation?
Well, I'd say you just start with, if you want to do anything other than the regular schedule, you have to start by just even discussing that with the office, because a lot of places won't accept even having conversations. They just want to do the CDC schedule. And if you have questions, if you have any sort of reservations, if you want to discuss it, which I think you should be able to discuss your questions with your doctor, then you should not go pass that interview without asking questions about, like, here's what I'm thinking about. I have concerns about this. I would like to discuss this. Are you open to it? You do not want to go into an office with a doctor that's not willing to talk to you if you have those reservations. If you're just going to do the CDC schedule, that's fine. You can go to any doctor that's going to do that. But for, I think, a lot of people that are listening to this podcast or that are a little bit more hesitant or that have questions, then you write down your questions and you ask them. And you start with, are you open to discussing vaccines? Are you open to doing a slow schedule? Talk to me about the pros and cons of doing something like that. What are your concerns? What do you feel like the benefits are? And see if they're willing to have that discussion. A lot of patients just come to my office just because I'm open to talking about it. I mean, it's really crazy to see, but the thing that most people want to talk to me about is vaccines, whether that's in the office or online. And that is because most doctors don't seem to be willing to do that. And I think if more people just start to ask basic questions, then the medical community is going to start to hear this, and they're going to maybe stop pushing back as much and start being open to listening to a little bit more of the concerns out there. And I think we need that. I think we need a little bit more humility in medicine and a little bit more openness to having these discussions, and to not assuming that just because somebody has a question about vaccines means they're, anti-vax, air quotes. Very few people are anti-vaccine. It doesn't make sense. I mean, RFK said it. It's like, you're not anti-fish if you're worried about the chemicals. You're not anti-vax just because you're concerned about something. You just want to make sure that what you're doing is the best for your child, and you should be able to discuss that with your doctor. Just like if you were getting cancer medication, we know that if you're going to get chemotherapy, that's going to have effects, right? You might lose your hair, might affect your immune system. Doesn't mean you're not going to do it, but you still want to have a conversation with your oncologist to say, okay, what are the pros? What are the cons? What is the likelihood this is going to work? Just because there are side effects doesn't mean you're not going to do something. You just want to understand what those risks are. And we're probably never going to have a vaccine with 0 risks. That's not realistic. But the question is, what are those risks? What is the long-term risk versus what is the benefit? And if you're not likely to see polio, then you want to know, well, okay, if I'm not going to see polio, what's the risk from the polio vaccine if I'm giving it to my kid? I don't just want to give it to my kid just because. I want to weigh the pros and the cons of that.
Amen. Yeah. Informed consent. It's all about informed consent. I couldn't agree more. Are there any red flags though? I mean, if your physician gets condescending, if he starts gaslighting you, I mean, what are some signs that you're probably in the wrong office?
If they're not willing to have a discussion, if they say to you, I'm not going to talk about this, you either do the regular schedule or get out of my office, then if you are someone who has those questions, you shouldn't go to that office.
Yeah.
Most people just do whatever they're told, and that's fine. If you just want to do the CDC schedule, that's what's been studied, that's what's recommended, you can go ahead and do that. But I think that for those that are listening that have concerns, you should be able to have that discussion. And more doctors are open to it. Not all of them. Certainly there are many offices that aren't, but they should be at least open to having a discussion with you.
It's a big deal. I mean, I had back surgery recently, and I was terrified of doing it because of the narrative that you hear that back surgery more often than not is, leaves you worse off than before. And so I met with 6 different doctors before I went through with the surgery. Mm-hmm. And I assessed each of how I felt, from gut level, instincts about how I felt about their competency, their knowledge, but just as part of my own research process. Like, I wanted to hear from all of them. And there were a variety of opinions, and ultimately it empowered me to make the best choice for me. And I ultimately went with it, and I went with it with the surgeon that I felt was the most competent. But why would you not, go through comparable effort when we're talking about your child, your progeny?
I think it's very important because mainstream medicine almost denies the fact that you can have side effects. They're listed, but almost anything that happens after a vaccine is just kind of brushed off as coincidence. And there's such a weird double standard when it comes to vaccines. Like, if you take an antibiotic, let's say take amoxicillin, and you have a rash a couple of days later, you're like, oh, it must be an amoxicillin rash. It's probably hives. It's an allergy. Don't ever take amoxicillin again. But a kid who has a vaccine and then a couple hours later or a day later has a seizure, you're like, Maybe it's just maybe they were just getting sick. Like, it's this weird thing that we have with vaccines where there's this double standard where it's never because of the vaccine. And I think if you go to an office where they won't even have these discussions with you, then you're in that situation where if something does happen specifically to your child where you have a reaction, you want to be able to discuss that and even think about the fact that maybe the vaccine caused this for your kid. Maybe your kid has specific genetics or is susceptible or whatever from vaccines, and maybe that's the kid that needs to go slower, or you need to be more mindful because they had a reaction. But if you just dismiss it, then that's the kid that's going to just keep getting vaccines and have more and more harm. And I've seen families like that. I had a couple of kids that had concerns about their heart after going somewhere else. Like, one baby got a vaccine and then had a super high heart rate after, went to the hospital, and then they calmed down, and they're like, no, it's probably not because of the vaccine. Went back a couple months later, they were concerned about getting them, but the doctor convinced them to do it. They did it again. Same thing happened, had to go back to the hospital. Still, the hospital didn't call it a vaccine reaction. Still, the doctor didn't call it a vaccine reaction. They still wanted that kid, who was now 6 months old, to get more vaccines, and they were going to kick them out of the office if they didn't do it. And they left. And they came to me. And what parent who just had their kid have serious reactions twice from vaccines? They're not anti-vax. They have an older kid that got vaccines, had them all. This kid had serious reactions twice. Isn't that the child where we should say, hey, maybe this is the kid where we go a little bit slower, or maybe this is the kid that we hold off a little bit and we give it to them later because they're having serious reactions 2 times in a row. That's probably not coincidence.
Amen. Why do you think this conversation has reached such a fevered pitch today in the context of widespread obesity and prediabetes in children?
I think I think there's a few reasons. Number one, because it's been censored for so long, and we went through COVID. Everyone saw that kind of evolution of the COVID vaccine and maybe had their own personal issues with it, or just concerns around the messaging around it. And we're now in a different time where we don't have as much censorship. There's a lot more opportunity to talk about these things. And everyone,
thank God, right?
Which is great. And I mean, that's one of the reasons why I can do this. I couldn't talk about vaccines before, which is terrible, but now people do want to talk about it, which is great. But I think people see that in the mixture of really unhealthy kids in general, and a skyrocketing chronic disease rate, cancer rates skyrocketing through the roof, and people are saying why. They see autism rates going from 1 in 250 to 1 in 150 to 1 in 22 in California now, and they say, okay, 20 years ago it was 1 in 150, now it's 1 in 22 here, 1 in 36 in the country. Why? It doesn't mean it's because of vaccines, but we have to look at what are we doing differently than we were doing 20 years ago. Maybe not everything we're doing in medicine is the best, and what is it that's going on that we can think about, that we can ask questions, that we can hypothesize about. And vaccines is one of those things, because we're giving more and more of them. We're giving them often. More and more people are saying they're having a reaction to it. And we just say, no, it's not because of the vaccines. But then everyone had issues with COVID vaccine, so many people. So they were like, well, if I could have an issue with this vaccine, what about the other ones, right? And I think that's a logical step that people have made. And it's not to say that vaccines are bad or that we shouldn't do them or that they don't have benefits. It's just to say, okay, well, are these related in any way to some of these issues that we're seeing? And if so, is there an ingredient in there that we could change? Is there something we could do differently in the schedule? Maybe we do it slower, do it differently. Maybe there's a way to decrease our risk. Why wouldn't we want to do that for our kids? If there's a way that we could decrease their asthma risk and decrease their allergy risk while still giving them the protection from diseases, we need to find a balance. It's about balance. And there's no balance right now. It seems like it's just do more, protect against the diseases. And most of these diseases are not even that common anymore. And we need to ask, okay, then maybe we need to find a little bit more of a common ground in the middle somewhere.
Yeah. I mean, this conversation wasn't really happening when I was a kid, but I was, I only got a couple dozen maybe, if that. And I turned out okay, but now it's just, I would be incredibly concerned at just the fact that there is this creep of, the amount of antigens, the amount of doses. I'm not even sure if I'm using the proper terminology, but like, who's to say that 10 years from now or 20 years from now, we're not going to have, in the hundreds.
Right. And I think that is a huge concern. And another, I talk about this in the book a lot, but I think it's a really important detail that we have to discuss right now, because what's going to stop us from having 100 vaccines or 1,000 vaccines. And if you look at some of the main books, if you look at things that like Paul Offit says sometimes, or if you look at some of the main websites, they say, oh, you could have 10,000 antigens, you could have 10,000 vaccines. Your body would be totally fine to handle those. And it is true that we are exposed to all sorts of things all day. You eat an apple, there's all sorts of bacteria, we're exposed to all sorts of antigens, but that's not the same thing as a vaccine. One thing is happening in the real world, another thing's happening in a vaccine. It's a synthetic product, and there are all sorts of other chemicals and ingredients in there. You ingest something, or something goes in the natural way, but a vaccine, you inject it. It's not the natural method of being exposed to something, and certainly you're not exposed to all the adjuvants and chemicals that are in that vaccine. So there has to be some sort of upper limit of how much aluminum you can have. There has to be some sort of limit of how many vaccines you have, and unless we can talk about that, unless we can say that, then nothing is going to stop companies from just bringing out a vaccine for every single disease, and maybe in 5 years there's going to be 100 vaccines or 200 vaccines. And what if the government says you have to get them all? And what if you start to think, well, I don't want to give all my kids all those vaccines. I don't want them to get 100 vaccines. I feel like it's increasing their risk to get cancer. I don't want to do this. If we don't have that conversation now, that is a possibility in a few years. And we need to make sure that we have a very high bar to bring something out into the market, to give it to kids, especially to newborns. And we have not had those standards in a very long time, if not forever, in this space. And I think that we owe it to our kids to make sure that if we're doing more, it's actually benefiting their health versus harming their health. And it shouldn't be controversial to discuss this. RFK talked about this study, which I heard and mentioned in the book on a news report, and it was so crazy. He was talking about in Africa, they were giving the DTP vaccine, diphtheria, tetanus, pertussis, and this was in Guinea-Bissau, and the kids were actually having a higher death rate if they had the vaccine. So they were looking, and it was 5 to 10 times higher death rate for the kids that had vaccines versus unvaccinated. And I was like, that can't be true. And then there's many studies showing that the kids that are getting these vaccines had a higher overall mortality rate. So they were not getting diphtheria, tetanus, or pertussis, but they were dying of other things because it was affecting their immune system. In theory, I mean, no study is perfect. Maybe those researchers were biased. I don't know. But these are the kinds of questions we should be asking, because if you're giving kids a diphtheria, tetanus, pertussis vaccine here, and they're protected from diphtheria, which isn't even around anymore, but they have a 2 times higher rate of dying from something else, we wouldn't want to give that vaccine to those kids, or we'd want to figure out why. You wouldn't necessarily want to stop vaccinating against tetanus, but you'd want to know what in the vaccine is increasing their risk to have other problems, and how do we minimize that? And if we can't ask those types of questions, we're doing our kids a disservice. And maybe it's not true. Maybe that's not the fact, but there is research out there that looks at those kinds of things and does call into question the long-term effects of these vaccines. And as we kind of mentioned before, there is no mechanism right now to look at these things. We have VAERS, which is the Vaccine Adverse Reporting System, but that's self-report. So you go in, or a doctor goes in and says, oh, you had a vaccine and you had a heart attack that afternoon. But who is reporting things 10 years later? If your kid gets the hepatitis B vaccine on day 1 and gets cancer when they're 10, you're not thinking, well, my kid got cancer because of the hepatitis B vaccine when they were 1 day old. You're not reporting that anywhere. There's no way to report that right now. The only way to know that is either someone has to think about these things and say, hey, I hypothesize that hepatitis B causes cancer 10 years from now. Let me do a study on that. Or you need to do a prospective study following kids over 10 years. But nobody's doing vaccinated versus unvaccinated studies. So we have no idea what happens in the future. We only know what happens in those few months pre-licensure, or if these systems pick it up. But they're not picking up things 10 years down the road. If you get autism, you're not relating it to vaccines. You're not reporting it. If you get asthma, you're not relating it to vaccines. But it's possible that those things 5 years ago had something to do with that. Maybe not, but it's possible. And the only way to know that is to study it.
Well, in fairness, those studies are probably really hard to do, to design, to run.
They're extremely hard to do, but they need to be done. Vaccines are a very important intervention, and the concern level around them has increased to a point where I don't think we can ignore that anymore, especially given we have more and more vaccines, and there's potentially going to be a lot more. We need someone to step up and say, look, let's do a prospective trial. Let's follow kids. We've done it before. We did it with the Framingham study, right? We did it with cardiovascular disease. You can get a group of people. You can follow them for the next 20 or 40 years. You can have people choose which group they're in. There are plenty of people that don't want to get vaccines, so they can self-select. It's not the perfect study because it's not randomized, but that's never going to happen in modern day. But you can do it unblinded, and you can see, and we can see in 5 or 10 years, how many kids that are vaccinated versus unvaccinated have autism? How many kids that are vaccinated versus unvaccinated have asthma? There are other things at play, but even still, if 5 times...
It must be garbage day.
Yeah. Is it going to pick it up, or should I just keep going?
No, keep going. I don't think it'll pick it up, yeah.
If 5 times the rate of kids have asthma in the vaccinated group than unvaccinated group, that's a good thing to know. You'd want to know, in this lifestyle, why are these kids having such a lower rate of asthma? Or maybe it's going to be exactly equal, and that's going to be the research that's going to say, look, whether you get vaccines or not, you have the same rate of asthma, and that's going to give parents confidence to do it. That's what people are looking for. That's what they're asking for. That's what RFK is saying that we need to do, and that's not unreasonable because it doesn't exist. And if we want people to have faith and trust in the system, in these products, we have to be willing to do those kinds of studies.
Yeah, it's so true. What would you say today are the biggest threats facing our children?
I think the biggest threats facing our children right now in terms of health is chronic disease. I mean, you have this mix of infection plus chronic disease, but about half of our kids are overweight or obese. We have a third of kids with diabetes or pre-diabetes. Asthma rates are skyrocketing. Autism rates are skyrocketing. Mental health concerns are skyrocketing. Basically, every sort of condition is skyrocketing, and it seems in general that we just say, yeah, nah, we're just better at diagnosis. It's not really happening more. We just, we're just noticing it, and we're better at understanding it, and so we test it more. And that's not what's going on. Anybody that's out there in the community, anybody that sees kids around, they're much sicker than when we were growing up.
It's so weird that the medical establishment has, instead, rather than holding themselves accountable, right? They brush off accountability and they find a way to twist it to take credit instead.
Right. It's very arrogant.
Right? We're just better at diagnosing it.
It's ridiculous. It's just such a crazy... We are better at diagnosing. I mean, there's no question about it. We're more aware of it. We're better at diagnosing all of these things. So that's a part of it. But most people don't remember anybody in their classroom having autism. They don't remember any peanut allergies. We're seeing things that we never saw in kids before. Diabetes, adult onset diabetes, literally called adult onset diabetes. You're seeing it in kids now. It was called that because you didn't see it in kids before. We're seeing cancers in kids that were never seen before in kids. So something is going on, and it's extraordinarily frustrating that we just brush it off as opposed to looking into it. We have to take accountability and say, no, this is happening more. Why? What are the 10 things that we're doing that we can change? What can families do? What can society do? How can we change the water that we drink, the air that we breathe, the food that we're eating? What we're doing on a daily basis, it's not working. It's not like we're dying at 40, so not everything we're doing is bad. I mean, there's a lot of great things that we've done in the last 100 years, but life expectancy is going back down, chronic disease rates are going up, and we have to acknowledge that and say a lot of what we've done in medicine was built at this time when infectious disease was the biggest problem. Now we have 2 big problems. We still have infectious diseases, but we also have chronic disease, and they're both important. And I don't know, I feel like doctors feel like if you start talking about chronic disease, then it's like you're brushing off infections, or you're never going to get a vaccine again, and they take it very personally when it's not a personal attack. You can be concerned about measles, and you can also be concerned about side effects from the measles vaccine. They can both be true. You don't have to just be worried about measles. You should also be worried about minimizing any risk from the products that you're preventing from measles too. And just because you're concerned about side effects doesn't mean that you're negating that the product could be useful or that measles isn't bad. It's not one or the other. It could be both.
Yeah, black and white thinking doesn't help anybody. It's not these issues are not mutually exclusive. We need to be talking about both of them.
We do, but I don't know. Medicine seems to be black and white, or it seems to be very concerned that any sort of discussion around vaccines will stop people from getting vaccinated, and we don't want that, so therefore we should never talk about it. And we know that's true because during the pandemic, that happened. I mean, Mark Zuckerberg said it very specifically that they were told to censor anything that created hesitancy, even if it was true, right? So how can you trust anything if we know that to be true? Like, that's what we're seeing, that's what we're hearing.
Amen.
And that is not going to get us to a place where people trust in our systems. I mean, we still have the COVID vaccine on the recommended schedule, still recommended for kids 6 months and above, and yet almost nobody's doing it, right? You look at the rates this year for the COVID vaccine for kids, it's like 10%. For adults, it's like 20, 25%. I'm not sure what the number is exactly right now, but it's about 25% from last I saw. So that means that the vast majority of people are not listening to the CDC, are not listening to the recommendations, and are doing something different. That's a big problem. If we can't trust our major boards, major societies to give us information that is good and that we should be listening to, we're going to get in this boy who cried wolf situation where something's going to happen and CDC, I don't care what they say. And that's where we are. I mean, when you have a recommendation that's done by 10% of people, there's a clear disconnect there because either society's wrong or the organization is wrong, or there's some sort of disconnect between the communication. But when you have a recommendation that's done by 10% of people, that's a weird place to be, and that's where we are right now.
Yeah. Well, and it also doesn't help to politicize this topic because, I mean, I think about the recently when that super unfortunate situation where the child died due to measles. He, if memory serves, I mean, he had a whole host of other, comorbidities, but this was in a rural town, a Mennonite community who have had longstanding cultural beliefs around vaccination. So there was, under immunization, but they tried to, chalk it up to RFK and the rhetoric, surrounding him and the politicization, because now everybody has, RFK derangement syndrome. So pretty much anything he says, because of his association with the current administration, it's like he's been made out to be the enemy. But it's like one thing had nothing to do with the other. And that was also the first death in a decade.
Right.
So it's, but it was politicized.
Everything seems to be politicized right now, but certainly health and certainly vaccines have been. And that is not the way to get to a better place. It's not to blame RFK or what RFK says. It's to listen to the concerns that people have and to get the research and the data that they want that will make them comfortable to do it, or that will show the concerns that people have and maybe make us change some of the guidelines around what we find. But if people just automatically demonize every single thing that RFK says, we're not going to move forward. And you don't have to love him. You don't have to love any politician, but there's no question that he wants to shake things up. And we need a shakeup. There is no question about that. You might not agree with the way he's doing it or where he wants to go, but we can all agree that we want healthy kids, and that's what he wants, and that's what everybody wants. You might not agree on how you're going about that, but we don't have healthy kids, and we're going in the wrong direction, and so anything to shake that up overall is a good thing. But if we make it political, then that is going to harm our kids. Health is not political. I think to a degree it's good that it became a little bit political in the last year or two, just because that got it, on people's radar. People started talking about it, but it can't continue to be political. It has to be something that would, if you're in America, Democrats, Republicans, doesn't make any difference. Everybody has kids, and if you have kids, it doesn't matter which one you believe in. If they have a chronic disease, it's not a good thing, and diseases don't know which party you're affiliated with.
Yeah, exactly.
So we need to get past that and come together. And even if you don't agree with every policy or every decision, get involved, be a part of it, and let's move the needle forward. There are a lot of things to do. It's not just about dyes. I mean, we were both involved in the Kellogg's and the dyes, and people, always mocked us like, oh, it's not about dyes. No, it's not about that. You have to start somewhere. There are many big issues that need to be dealt with, but you have to do one thing at a time. Not everything's going to change in 2 or 3 months. It's going to take years, but we need to at least call out the BS. We have to call out the concerns, and then we have to start working towards getting better solutions for everybody. People say all the time, oh, well, you're worried about dyes, but there are food deserts. People can't afford things. All those things are true. You can be worried about dyes in food, and you can also be worried about making sure that everybody has healthy food. Everyone deserves healthy food, but you have to start somewhere. And it's a lot easier to get dyes out of a product than it is to change our entire food system. That's going to take a long time. So we need to have one thing move us forward and take baby steps and start to move in a better direction. And that's what I think is happening. And not everything that's going to be done you're going to agree with or I'm going to agree with. Doesn't matter who's in there. No one's going to agree with everything anyways. But we at least need to come together to move forward to a better place. And I hope that we're on that path.
I think we are, man, and you're definitely a foot soldier that I'm proud to have fighting on behalf of our nation's children. I think it's this is a super important question to have, and not everybody has the courage to initiate it or to be in the fight as you are. And so I just want to celebrate you, and I'm super excited for your new book, and thanks for doing the work.
Thank you. Thanks for everything that you're doing as well.
Of course, brother. Where can listeners find you on social media? Where can they pick up the book? Yeah, just let my audience know.
You can find me at Dr. Joel Gator on Instagram or X, or you could find the book, all the places that books are sold, Amazon, or you can go to theshotbook.com.
Theshotbook.com, and it's called Between a Shot and a Hard Play. I think it's such a great title.
Thank you.
Yeah, it's a beautiful cover. Well, thank you, Dr. Joel Gator Warsh. You were on the show in the past also. I remember we had a really great conversation the first go around. So if you enjoyed this episode, be sure to go back and check out that one. That was a really good one. Touched on some of the same topics, but different ones. Food. I think we talked a lot about food and lifestyle and sort of other arenas in the space. But again, thanks for your time. Thank you guys for tuning in. Appreciate you. Share this around with people in your life that may benefit from it, and I will catch you on the next episode. Peace. Hey, if you liked that video, you need to check out this one here, and I'll see you there.